You're good. That's all you need.
No, this one is for the attendees list and my documents. This one is for the Zoom tiles.
Let me just stand between you. Oh, that's right.
Lots of room like this.
Yeah.
Where's everybody? Isn't that what your pockets are?
Yeah.
So, will you rather be here? Huh? Will you rather be here? I feel like I'm in the middle of the table. I know they just moved you around.
I did.
It seems like you ought to be in one of these two seats or there. Okay.
Mayor, we are good whenever you are.
We're live on YouTube and UGTV.
Mayor, we are also ready.
All right, good evening. We're going to go ahead and get started. We do have a full agenda on the special session. I'd like to announce that due to COVID-19, we have individuals attending remotely. All participants joining by phone should mute their phones when not speaking to avoid background noise. And during the meeting, please make sure that you announce yourself by name and title every time you speak, so the public that is participating knows who is speaking. This is critical given the number of remote participants and its current guidance from the Kansas Attorney General. I ask the clerk to announce the meeting and call the roll, please.
Good evening. You are hereby notified that I have called a special session of the Unified Government of Wyandotte County, Kansas City, Kansas, to be held Thursday, July 1, 2021 at 5 p.m. in the 5th floor conference room, 701 North 7th Street, Kansas City, Kansas, for a budget workshop. Roll call. Townsend.
Present.
Kiernan.
Here.
Ramirez.
Here.
Johnson.
Here.
Kane. Here. Markley.
Here.
Walters. Philbrook.
Here.
Bynum.
Here.
Burrows.
Here.
Alvey.
Here. Thank you. So tonight, budget workshop. I'll turn it over to Mr. Bach to introduce staff.
Thank you, Mayor. Doug Bach, County Administrator. So for tonight's presentation, we're going to walk through a few different areas from a budget workshop perspective. One, our revenue estimates, which is important for all of you to take in to understand just where we are as we concluded last year. And then as we're able to move through getting about 6 full months into this year, it certainly puts us in a better position when we start to project where we're at for the coming year. We also wanted to walk through where we are with the American Rescue Plan and the dollars that are coming in from that perspective. I know we've reviewed this some with you, but this will allow us to go into a little bit more detail of where we're at and some of the things we're looking at for this. And also then I wanted to talk about employee recruitment, hiring, and retention, which is really a very big cost center for us. It's also becoming a very big issue for us as we are trying to keep people into our organization and hire them into our organization. So with that, I'm going to turn this over to our Chief Financial Officer, Kathleen Von Atchen, and let her make presentation on the revenue estimates. Kathleen.
So, yes, we're going to start off with the revenue estimate. And so typically we start off the budget process by looking at how much money is coming in. And so our budget process typically begins at this point, except it's been delayed somewhat by a new state law. So we're now examining an amendment to our current year 2021 budget and working towards development of our 2022 budget. So next slide. Before we start off, I thought we should look at, just getting to know our revenue base and what supports our services. These are total revenues across all the unified government, excluding one-time revenues and other financing sources. And you can see since 2017 to 2020, there has been some revenue growth, but you can really see that it's varied quite a bit. In the first year in 2017, it went up 5.2%. Then it dropped by, then it only grew by 1.3%. In 2019, we had a good year, and that grew by 3.1%. But then with COVID, our total revenues actually declined by 2.9%. So we're ending the fiscal 2022 with revenues roughly in the range of $318 million in total. And over there on the side in the box there, you can see generally what contributed to some of the revenue growth and decline. We did get that big star bond increase. And so that contributed to the $15.5 million increase in 2017. But then in 18 and 19, the growth was at 4.1 and $9.6 million each year, even despite the fact that we had a 2 mil reduction in those years. So, and then in 2020, across all the revenue base without any one-time revenues we saw a decline in revenues of $9.4 million. That's during our COVID. Next slide. So just going to recap on some of our major revenues, property tax trends. As you can see, since 2007, when the Great Recession happened, there was a decline in property tax revenues during that time. But then since then, it's been growing steadily, reaching $97 million in 2020. So between 2017 and 2019, Kansas City, Kansas mill rate was reduced by 6 mills during that time period. And the UG is relying on property tax revenue for supporting our operations. Now, not so much in the city general fund, but, oh, you switched. Not so much in the city general fund, where only 17% are relying on property tax, but very much so on the county side, where 62% of our operations is supported by property tax. So, this growth is needed to cover public safety employee costs and to support needed cash-funded capital projects and equipment acquisitions to replace aging equipment. And so all of that to deliver quality services to our residents. Next slide. The next largest is sales tax, and that has trended upwards mainly because of the STAR bond payoff that occurred in 2017. But that STAR bond payoff and the fact that we reduced our mills during 17 through 19 increased our reliance on sales tax as opposed to property tax. And so generally sales tax, so since the STAR bond collection in January 2017, sales tax receipts have been relatively flat. And that unfortunately, they've ranged about $4 to $5 million each month. And, they did drop during COVID in 2020, they dropped by 1.85%. They didn't drop as much as I anticipated, so we're very fortunate for that. But, and they have rebounded afterwards. The next slide is use tax. So we don't often talk about use tax, but it's now becoming a more prevalent revenue source, and it's derived from the equipment acquisition of new company startups and as well as online sales. So use tax receipts have grown from 7 million in 2007 up to 13 million in 2020. And the COVID-19 did not greatly impact this revenue as you would think it would have, because overall the total only increased by 1.6% in 2020. And part of that is because of the composition of that sales or that use tax, where the amount we get from company equipment acquisitions and startups varies greatly depending on what companies are doing, and so that causes that total to change quite a bit. In 2020, we saw a 55% increase in online sales, and which contributed to an additional $3 million in use tax collections. And you can see in 2020 how the light green amount was greater in 19 than in 20, and that's the amount that we got from other types of uses. And the dark green in the graph there is the amount from online sales. So it's really picking up online sales and use tax collections. The largest in the retail sector for online sales is Amazon, and as you probably would have guessed. So the next slide is another large revenue source for us, and that's the payment in lieu of taxes that we collect from the Board of Public Utilities. And that amount is not only a franchise tax, but it's also a payment in lieu of property tax. It's calculated by 11.9% of the gross revenues of the electric and water utility. And the unified government sewer and stormwater utilities also pay the same, or a pilot as well, just so y'all know. And so the total 2020 pilot equaled $32 million, or almost $33 million. That is down 4.2% from what the amount we collected in 19. And with the split being 27 million from electric and 5 million from water. So the BPU did experience a $7.5 million drop in electric consumption during 2020 due to large industries and businesses being forced to close during COVID, and that consumption declined. And major industries, some of them are not expected to come back onto operations until the end of 2021. So that revenue source is going to continue to struggle. The next slide. So the next two slides talk about our estimates for the upcoming budget. So we're going to amend the current year budget because the revenue estimates that we currently have in the budget for the current year were done last summer when there were a lot of unknowns. And so we're going to change those numbers, and then we're going to estimate what we think is going to happen in the next 18 months, right? So I've included a little bit more information to give you some context for 2020 here. So sales tax, although it did decline 1.85% last year during COVID, we are expecting a rebound, basically a catch-up for the 2-year period with 9.8% growth based on year-to-date trends. Because we're doing revenue estimates a little later in the budget process, we have more data. And those restoring the receipts, basically this increase is, if you compare it against 2019, is a 7.8% increase. And then for 2020, we're going to use 2.2% growth rate, just based on prior year growth rates, a conservative growth rate. The use tax, which is another component of sales tax, and as I mentioned before, it grew by 1.6% in 2020. We're expecting it to grow by 16.8% in 2021, based on year-to-date trends. And basically, the receipts have really picked up in the first quarter of the first half of 2021. And then in 2022, we're expecting it to grow by 3%, based on prior year growth rates. Property tax in 2020, that revenue grew by 4.3%, and that was based on an assessed value for Kansas City, Kansas of 4.9% and a delinquency rate factor of 7.2%. So the 7.2% delinquency factor, although it's not as great as I budgeted or expected, when we were in the middle of the COVID, it is greater than the amounts that delinquency rate that we had in the prior years. So in the prior years, it was around 5.7%. So it has picked up. It increased to 7.2%. And I believe that in 2021, or actually, we've almost collected all the revenue from property tax. So the current delinquency rate in 2021 is at 7.4% right now. And the growth, it happens to coincide the same with the growth in the actual revenue source, based on a 5.4% increase in assessed value. Now, the appraiser and our UG clerk have already certified the property tax assessment value, and they've come in at a 3.5% increase for assessed value in Kansas City, Kansas. And I'm anticipating that the delinquency rate will drop to 6.6%. So that results in an increase in property tax of only 2.4% overall. Excuse me. Go ahead.
Can I ask a question?
Yes.
Go back one. So the 2022, why would we only anticipate a 2.4% growth? And you're talking about assessed value of all property, commercial and residential, correct?
Yeah.
And do we know why? Because clearly the trend is higher and higher, 4.9, then 5.4. I don't understand why, how did we come to a 3.5%?
Well, so this is, okay, so I'll tell you why. So this is, this property tax includes all the property tax, including the county, right? So I, just for simplicity, I put just the Kansas City, Kansas figures. So the Wyandotte County assessed value figures and delinquency factor are slightly different. So that kind of, the melding of the two combined calculations resulted in that 2.4%.
I guess what I'm questioning is if the average increase in value in 2020 was 4.9 and then 2021 was 5.4, why would we anticipate even slower growth? Which, because from what how I understand where the markets are, there's a demand for housing, especially affordable housing, and we have a lot of that still. I mean, and so that's being bid up. So I just 3.5 seems low to me, but
Okay. Well, so I meant to mention that in the back of your packet, there's some additional information, like 25 or more slides that talk a lot about the different components of each of these major revenues. And so one of the packets in your slides, which I can refer you to, is how the property tax assessed value or the assessed value, what components it contains. So it is, basically half and half residential and commercial. And commercial property, sadly, residential property has been increasing at a good clip in the 7 to 8% range, or we're even 9 over the past few years. But commercial property has really dropped quite a bit. And so this past year, it dropped significantly. In fact, it only increased by 0.4%.
I got it.
There's also the state assessed utilities, the railroads and the utilities that are assessed by the state, and those really declined as well this past year. And then personal property every year declines because of a statute that was changed back over 10 years ago on how they handle machinery and equipment. So unfortunately, that combination of half of our assessed value actually declining really drew down the assessed value in total for the county and the city.
Okay, thank you.
Yeah. And then the other point is that we are the 2022 will be our third out of 4 years in which we are refunding Hollywood Casino for property tax they paid in protest previously, which we lost that lawsuit. And so that has a $1 million impact on the amount we collect. So, but I recommend that you go through those slides and take a look, and I'm happy to answer any question. Okay, the next slide. Good. So the second slide here has to continues to talk about revenue estimate assumptions. So fees, permits, fines, all across the UG declined by 12% in 2020. And in 21, based on year-to-date growth, it looks like we're going to pick up back where we were in 19 with a 13% growth rate. That doesn't mean that it's going to, create a whole bunch of new revenue. It's basically the same as what we collected 2 years ago. So just keep that in mind when you're looking at these growth rates. In 2022, 3.2% growth rate, based on modest increases in various services that are tied to that have CPI factors in their contracts, such as sewer, garbage, and other areas. The BPU pilot, as I mentioned before, the consumption level in the electrical, utility is struggling as industries are slow to coming back online. So in 2020, we saw a 4.2% decline over 2019 due to lower kilowatt hour consumption and water consumption due to all the closures. And in 2021, based on year-to-date trends, we see that it won't be as bad, but it's going to continue to decline by 1.3%. And then in 2022, we think things are going to resume and that certain industries will be coming online in the tail end of 2020, resulting in a 22 for 2022, a 3.5% increase. And then lastly, you know, transient guest tax is not a big number, but it was tremendously affected by COVID. It declined by 33% due to less tourism activity in 2020. We see it coming back to 26% in 2021. And then another 24% growth rate based on as tourism resumes and also anticipating new hotel days. Next slide. So this graph shows the major revenue sources, and what I've provided you is some information so you can get a little context of the years. So in the green is 2019. We skipped 2020 because we all know that that was low. And so we're just looking at 2021 original with the yellow, 21 revised, which is what I've been talking about for in the light orange, and then the darker orange is our estimate for 2022. And so overall, I just want to point out, I don't think I need to go over each of these, but you can see how some of these revenue sources are actually were affected differently by the COVID. And although we are improving and picking back up to where we were before, we are not quite where we should be. If you factor in the fact that had there not been any COVID, these increases between the 2 years would have been greater than what you're seeing. Overall, all of these four revenues comprise of 85% of the total 2022 general fund revenues, and which are totaling $222 million. And the revenue estimates in total demonstrate that we only have $5 million in new money for 2022 to reallocate for growing needs in our operations or new initiatives. So
Catherine, just to be clear, is it only, okay, $5 million in additional revenue? Go back one slide. But it's only this only represents 85% of the total. There's no net revenue growth in the other 15%?
No. This is just to point out that graphically, I'm only showing you 85% of the
And that
revenue.
85%,
But
5%, $5 million.
Yes, the total only represents $5 billion more in additional revenue. Yeah. And that's just a consolidated city, county, parks, general fund.
Kathleen?
Yes.
Why are you just showing us 85%?
Well, just because it would be too busy if we showed all the revenues here. I could we could show you all the other revenues.
I think I would have liked to have seen the 2020 in relationship to the prior year and the current year, just to see the fluctuation, just to see how it's been affected. That's just a comment that I have. I would love to see a bar for 2020 on all those, but.
Okay. Well, I'm happy to provide that. It's real easy. So we can send that back out to all of you, along with the other 15% in revenues too. So this is a preliminary outlook of the Consolidated General Fund. We provided a couple of years as context. So in 19, we had total revenues of $213 million with expenditures of $210 million. So that was a net margin between revenues and expenditures of a positive $4.2 million in 2019. So that gave us an ending fund balance back then of $42.3 million. And this is based on the comprehensive annual financial report figures. That represents 20% of our expenditures and transfers, which is greater than the 2-month minimum target reserve. A minimum target reserve is roughly 16.7% of expenditures and transfers. So, that was good. Now, we've provided 2020 original budget, just to give some context of the difference in how much money we collected, sort of as a baseline of what we would have collected had there not been COVID, and then how much we did collect. So we don't have too many columns. So we just used the original budget and then actuals to show that difference. And so in 2020, even though we budgeted at the beginning of the year, not knowing about COVID, $219.6 million, we ended up collecting $208 million. So there's that, reduction in revenue that we experienced during COVID. On the expenditure side, we originally budgeted $223 million, but we ended up only spending $205 million. Now, much of that, as you can see in the capital outlay line, was due to reductions in cash capital and equipment acquisitions. We reduced them, but certainly, much of that has to be done later. It's not going away. So if equipment needs to be replaced, it has to be replaced in the subsequent years. And then the big difference in expenditures, certainly the departments really did step up and make changes to their operations and cut costs. And we did hold off on hiring positions, but it's also due to reimbursement of public safety expenditures coming from the CARES Act, which were recorded as a net negative against the expenditure line in 193. So that you'll see that a little bit too. So as a result, rather than ending the year with a deficit net margin, we ended the year with $3.3 million in the positive. And you're going to see that later in the comprehensive annual financial report that you'll see at the regular meeting later on. So we ended the year with 22.3% of expenditures and transfers, which far exceeds it exceeds the 16.7% 2-month operating target that we had. So in 2021 original budget was put together after we knew a little bit more about COVID, but still weren't sure about what was happening with the fall wave and perhaps, when the vaccine was going to come out. And, all of that was still an unknown when we did the budget last summer. And so we estimated that our revenues were going to come in at $215 million. And we're now saying they're coming in at $222 million. So that's $7 million greater. On the expenditure side, we budgeted $214 million on the top end there. And we're anticipating, $215 million. So we're anticipating an increase of $1 million in that expenditure line. And that basically accounts for a number of contract changes that have been adopted since during that time. So over the past 6 months. We have made some slight changes in capital outlay that we showed you during the CMIP process, and transfers out we're recommending some transfers out because of some obligations that we chose not to do because of COVID, and now because we see that there's a little bit more money, there's more money available to pay back some of the obligations that we had. So, the good news is the net is that between revenues and expenditures for the current year, we see only a $500,000 net difference. So between revenues and expenditures. So we expect to end the year with a percentage of expenditures and transfers of about 20%. So now we're not showing you the 2022 year yet because that's part of the budget process. We still need to go through and examine our expenditure levels and work through our process with our departments and the county administrator's administration. So any questions on this?
Yep, thank you.
So as I see in the big picture here, we're expecting about $7 million more in revenue in 2021. And most of that, $5 million of it, we're just going to put in the bank. and increase our fund balance. Would that be correct?
No, we're not adding any in 2021 to the fund.
So I see, help me with this, $7 million in revenue, $2 million in additional expenditures.
Yeah, so when we did the original budget, we anticipated using our reserves at the $5.2 million
I see.
level. Yeah,
So we're only expecting to increase our expenditures by $2 million.
yes, that's right.
All right, thank you.
Oh, yeah.
Yes, again, I think please use the, raise your hand because I can check it on this. I may not see you otherwise. Thank you. Commissioner Kane?
Okay, Mayor, this new computer, bear with me. What is the actual amount of monies that we lost last year through the pandemic?
Well, so we've been talking about how much revenue we lost because of the pandemic, and so in the future, well, actually in the next presentation, I'm going to talk about the revenue loss, right? And that revenue loss figure is calculated based on the Treasury guidance, and it only includes certain revenues and not others. This is the total big picture for the general fund. And so you see the total picture and you can see the difference right here. Yeah.
Somebody just in a little plain card. I want to know what we thought we were going to do, what we did, and where we're at for 20. And I want the exact same thing for 21.
Yeah,
Because
okay.
your numbers are confusing me. And like what Jim's saying, it looks like we got more money than we ever thought we were going to have. And then exactly how much stimulus money we got last year, how much stimulus money we think we're going to get this year. I
Yeah.
don't like this chart.
So this is
I'm not
just
done.
the general
I'm not
fund?
done.
Oh, okay, sorry.
So all it is a little bit, I'm not asking for a great big long chart. I'm asking for something super simple. The KISS theory, keep it simple, stupid. Because if you want to confuse somebody, go ahead and read that chart. So I'm asking for that, and I hope we get it before the 7 o'clock meeting. I hope I get it before 7 o'clock meeting.
And so if you look at the top line up there where you see the total revenue and transfers.
Yep.
And where we see 2020 original budget, 219.6 million. And then the next line, 2020 actual, 208.9. So this is an isolated picture of the consolidated general funds. We got 11 million less in these funds than what we originally projected in 2020.
Yeah, that's right. Yeah.
Okay, now, what Kathleen was saying is she's going to show you in the next part of the presentation, there's a bigger number that comes together because we look at all different areas and different formulas. But if we just look at these funds, which are our taxing ones, that we were down $11 million last year.
Okay.
Yep.
One more time.
Yeah.
I want it simple. I want it where I can read it with, I don't care, add all the numbers you got. But I want to be able to say to Joe Citizen, here's what it is. And if I sent this to Joe Citizen right now, he'd be going, what the hell does that mean? So
I think we'll be able to provide that to you
I want it separate.
that way.
I mean, I don't care if you show it up here or not, but I want one specifically like I asked.
Yeah.
Next slide. Any more questions on this?
Yep.
Good.
Why is this not showing up here?
Put it back, put it back.
Why is this? Go ahead.
Well, so just to help my confusion,
Um,
$5 million that we're going to put in the bank is the difference between $40 million that we thought we were going to put in the fund balance and $45 million that we're now. We are making a conscious decision increase our fund balance by $5 million.
Jim, I'm coming, following the same thing you're following.
I'm looking at
Yeah, the 5.2 and the 0.
40.4 ending fund balance in the 2021 original budget. And the 2021 revised estimate is 45.
Well, so the reason so yes, but we ended the prior year with $45 million, right? That was based on a lower revenue estimate. So in 2021, right? Because we're not taking in all the revenue we need to have a balanced budget, we're using in the original budget $5 million. Actually, the fund balance goes down. So the decision when we did the original budget was actually to use 5 million of reserves. Now in the revised, we're not using the 5 million in reserves because the revenue number went up.
Right. We are making a decision. Using that 5 million was okay when we approved the original 2021 budget. Now we're changing our approach, deciding to put $5 million more in the bank.
Yes, so some of the budget amendments that you're finding in the revised estimate for expenditures and capital, some of those decisions were made when the labor contracts were approved. Not all of them, but as part of the upcoming budget process, we will be reviewing with you all of the department requests. So it's not a done deal, and it's just an estimate, as I have in that column.
Commissioner, I'll probably a decision based on an estimate. There's no decision until we do a budget and go through and adopt it. This is how the numbers add up today. So if you want to call that a decision, because we're just showing you how the math works, because the bottom line is, as you're saying, we were calculating we were going to have 45 million in fund balance, or we're 45 million beginning fund balance, and then we'd end at 44. Because the math worked that way, we redid our 2021 estimates. I could have a 2022 estimated up here budget too. It doesn't mean we made a decision on it. Those are just early projections. So
Yeah.
taking 2021, because we've adopted, we know some certain expenses are already going to be here, that are some changes, what we know is the new revenues. That's how the math works out. And it does move that 5 million like that, like you're saying, if we let it end up like this.
Thank you.
Why is it not showing? Rocky?
You have Commissioner Johnson.
Okay.
Go ahead. Go ahead first, Commissioner Johnson, or
Okay, thank you.
why is this not doing this?
Yeah, I did not look at this in terms of any conscious decision. But what I will say is that
That's just,
it appears to me, Kathleen, that we did better than what we anticipated by these numbers.
Yes.
And for that, I do want to appreciate you and Doug. And I want the commission to understand also, a lot of this is coming from our directive as well. I don't look at that as a conscious decision. I look at that as that's what happened. And so the question I have, I think, is more along the lines of Commissioner Burrows when he asked the question, how those federal funds or those care funds or those other funds that came in during 2020 and maybe 2021 affect the overall numbers.
Right. Okay. Well, so the CARES Act money was deposited into the grant fund, which is not showing here.
So it's not on there.
Right. But some of those funds were deemed as public safety reimbursements. And so when those funds, when that money came into the general fund, it reduced the expenditure line because we were reimbursing public safety costs. Now, off the top of my head, I can't remember how much that was. So we'd be happy to bring back how much that was and what the impact of all the CARES Act dollars were.
Yeah, I think it
On
would be
this,
important for us to know
Well, that's why.
Yeah.
the impact of the CARES Act, however it was plays out on the revenues or on the expenditures
Yes,
as
but
relates to.
not in the
reimbursement.
revenue line at all.
Right.
It's all in
But it's just in
expenditure.
expenditures. It would be interesting to know how that affected the overall bottom line. I think we're moving in the right direction. I think also that we are not out of the storm. I think our buddy, the Wizard of Omaha or the Oracle of Omaha said that everything is still kind of uneven. And so we don't know where we're going to be yet in terms of trends. And so I think we're not out of the woods yet, but I appreciate, and I want to say that publicly, the directive that we're giving to you as well as Doug and your staff and how it's playing out. So, thank you.
I think Kane is there.
Commissioner Kane, go ahead.
Oh,
A comment was said about the unions getting raises, and the goal is to always give our employees raises. But I believe there are several people on staff that got a major amount of raises. So we should never just point out that one class got raises and others didn't. When the class I'm talking about, some of them got up to 20 some odd $1,000 in raises. That affects the budget as well. So, and I'm a firm believer that every single person should always get the exact same thing, that we shouldn't feed the top and not feed the bottom.
Commissioner Burrows.
Thank you, Mayor. Kathleen, if I understand some of the questions that are being asked, we were, 2020 budget, we were going to use $5 million of reserves.
right.
Now we're not utilizing those reserves, so that's the $5 million that you show. So we're actually at a push. Is that correct?
Yeah.
Okay, I think that's the simple language that
Yeah.
we're not using the 5 million. We've had 5 million more, so we're back to our bottom line that we wanted. So we're at a push. We didn't get as hurt as bad as we thought we would, and we didn't have to hit our reserves. The second question I have is in reference to the CARES Act money. We have, within the CARES Act money, there were administration costs that we were able to attach to utilization of the CARES Act money. And I think in some of that breakdown, those administration costs could have gone to us collectively as a unified government for staff to do the work, or it could have been utilized to outsource for an audit to ensure that we're in compliance with what the Federal Reserve and or the treasurers are asking us to do with those dollars. I think it would be prudent for us to break down those expenses if we took an administration fee of 5%, how much money that might have been and how that came into play within the budget, as well as any other dollars that were utilized to supplant budget expenses so that we as a commission have a more thorough, transparent understanding of how those dollars were spent. I think maybe that's what I hope to be able to get to. And it can be very simple and very cursory report just to ensure that if we were able to bring in $1.2 million for administration, how much of that $1.2 million of administration was actually spent. It was charged to the CARES fund, but did we spend it? Did we save some of it? And is it part of that $5 million? I think that's what I'm looking at to see if those dollars were spent prudently and not just banked for a later day expense.
So I'm happy to provide you that report, and I'm also happy to maybe give you a little synopsis to respond to that question. So, you know, we collected around 37 million in CARES Act dollars. We formed an internal team including Crystal and a variety of internal staff, and we diverted their salary while they were working on that CARES Act team from the general fund and other places within the UG operations to the CARES Act fund, grant fund, to pay for those costs. I don't remember offhand how much that is, but it comprised 5 or 6 or 7 people for about 6 or 8 months. And then in terms of the accounting, the audit function, we have an external auditor that comes and audits our books. She's been working with our my accounting manager for the past 4 or 5 months on the comprehensive annual financial report. And her team and her firm will also be examining the CARES Act in the coming months when the single audit is due out in another 3 months. So, and offhand, I don't remember if there is an additional cost related to her audit work of the CARES Act. So I just need to double check, but it would be pretty minimal. So, we tried to minimize the administrative costs related to administering the CARES Act dollars. It took a lot of effort to get it all the money spent and expedited according to deadlines, but we used internal staff as much as we could. And I think Alan House may be able to add some more information on that.
I think you're right. And we can get the exact numbers for you. I think it was in the $500,000 plus kind of range for that administrative cost. It was well below the sort of max threshold set within the CARES Act for administrative costs.
And basically what I'm looking at is cost avoidance, because that's basically what we did. We didn't have to absorb the cost in our budget. We absorbed the cost through the CARES Act dollars.
Right.
And it would be prudent for us to know, was it effective enough that we have learned something from it? And it was talked about raises. Were raises included from that CARES Act administration dollars that went out? I don't know. And in all full transparency, it's really not what I'm looking for. I'm just wanting to ensure that we were prudent and we were under a very narrow, aggressive timeline to get those monies out. So I do know that we should at least ensure that what we did was correct and what we have an opportunity to learn from that going into next year when we get the ARA money, that ARP money that's coming in.
Yeah, we we learned a great deal from administering the CARES Act. And in fact, one of the things that I learned is that we need to spend more focused time standing up a grant management team, including writing a grants manager manual and a grants policy. So those are things that we plan to do in the coming months.
Thank you, Kathleen.
Commissioner Bynum.
The other piece of that is that we at Administration and Human Services Standing Committee that Commissioner Merkley chairs, we were having almost monthly updates on that. And so what you're asking for, Commissioner, I think could probably be pulled from some of what was presented at some of those meetings last fall when we, as that committee, were receiving pretty regular updates on that whole process. And I do think that the 37 million CARES Act experience was just a warm-up show based on, what we're going to be dealing with now. So it was a good experience and we probably did learn a lot, but I think some of what Commissioner Burrows is asking for is pretty readily available.
Kathleen, wow. I'm not going to talk until I get this.
Well, along those lines, you give me a great idea, which is I think it'd be really helpful if we had kind of a closeout CARES Act report that we can put together and provide all that information and then put it up on our website. So, yeah. So should we go to the next slide? Okay. So this is the last revenue slide. Just because we often overlook some of the special revenue funds. So in general, some of the key ones are dedicated sales tax, which is of course all sales tax. It's a derived from 3/8 cent sales tax dedicated for public infrastructure in our neighborhoods, as well as police and fire personnel. And, it suffered during the 2020. And so but in 2020, we're expecting in 2022 for it to rebound pretty nicely. And part of the drag on that is that it has, the Legend Star Bond money in the general fund is capped, right? So any growth goes to pay off the bond. So it kind of drags down the total in the general fund. But here it's not capped. So any growth in the legends is reflected in these funds. So. And then the street and highway fund, those were really estimated to be pretty low because gas prices dropped during the COVID. And, but they seem to be rebounding now. So tourism promotion seems to be rebounding too, as I mentioned earlier with my estimates. The sewer fund is, you see here is just a reflection of the 5% growth rate in the charges for services, which is part of that, the settlement agreement.
I don't know.
And then EMS, again, is one that's really dependent on two things, but mainly sales tax. They have a 25-cent sales tax. And so it's impacted as well. But like the dedicated sales tax fund, it captures all the growth in the legends. It's not kept by the bonds. So that's all I got for revenues. And
We have
got lots of.
Commissioner Johnson has a question.
Yes, and I'm sorry, Kathleen, I forgot to ask how our results, both actual and revised, are compared to the national results, the national trends that we're seeing, as well as do we collect data on similar urban municipalities and just to see how we're doing overall relative to what we're seeing across the nation and in similar types of cities, not just size, but types of cities, I suppose, in terms of percentages and things of that nature.
Well, it's early going for me to really get data nationally. I know that the National League of Cities puts out a great status report. It doesn't come out until the fall, I think.
Okay.
But we do have meetings with other public finance directors in the region, and we share information on what we're estimating, what we're seeing. And just anecdotally, I can tell you that all the finance directors in the region are really just blown over by the performance of the sales tax over the last few months, which really has been significant, and the growth in online sales. So
For Wyandotte County specific?
No, all over.
Overall.
Other, Lenexa and Overland Park, all of them have said that they're really, it's really surprising.
Okay.
But we can put together some information for
But
you.
once it's available, I'm sure you all will.
Okay.
Commissioner McKiernan.
Thank you, Mayor. So as Commissioner Johnson had requested with the earlier multicolor graph that looks like this, I'd love to see the 2020 numbers as well.
Okay.
And should we assume that we spent 100% of these revenues collected?
For
For these
21,
funds? For these funds all years. I mean, we're showing revenue. Did we spend 100% of what we collected?
oh, well, so, in subsequent meetings, we're going to show you the fund position of each of these. So that will include the expenditure part.
So in an upcoming meeting, we'll get expenditures by year to match
Yeah.
this revenue by year.
Yeah, and then the fund balance, yeah.
Thank you.
Yeah.
But that kind of takes us back to the question that Commissioner Walters was pointing to, that we did not draw as many reserve funds as we had anticipated,
Right,
but we still were down 1/2 million.
yes.
Okay, from the reserve funds.
And it's an estimate.
Okay, gotcha.
All right. So the
One other
next press.
point, I think
Yes,
that
go
Commissioner
ahead.
Burrow's question, was there not necessary when we expended the funds, the Recovery Act, we had to provide an accounting, it was audit by the state government first, correct? Because that's where the funds came from. And then ultimately, the Treasury Department also had to sign off on what, and maybe Commissioner Bynum and Commissioner Markley can remind
No,
me.
we got the money from the state. The feds gave it to the state and they gave it to us. And they reviewed the expenditures to see whether they met the guidelines, and then they approved them,
I see, okay.
But the actual audit would take place in the coming 3 months by our external auditors.
I see.
There may be a chance that the state will come back and audit us later on, but.
Okay.
Mayor, we have I don't know that they'll talk about it tonight or we can ask, but the comprehensive audit goes through, but then they are currently doing a single audit on just our expense of the care stuff. That won't come back to us probably till the end of the year.
So the next presentation has to do with ARPA, the American Rescue Plan. No, just next presentation. It's not this one. That's that American Rescue Plan. Yep. So we're going to go through these these slides rather quickly because we want to kind of get towards the slides at the end so that give you more time to discuss the topics and the policy areas. But generally speaking, next slide, the American Rescue Plan it covers costs between now and December 31st of 2024. And then we can incur the cost until then, and then we can actually spend all the funds another 2 years. So it reaches all the way to 5 years into the future. And the allowable expenditures are these 4 categories: mitigating COVID, premium pay, revenue loss, which can be spent on government services, and then infrastructure. Those are the places you can spend the funds. And due to our size, our population, the Treasury allocated the Wyandotte County $87.4 million in revenue. We received half that revenue in May, and we would receive the other half in the middle of May next year. All right. So the next slide. So just want to talk real briefly about some of these allowable expenditures. So in the first category, containing and mitigating COVID, we can spend it on the public health response, medical and behavioral health care needs, and mitigating disparities. And at this point now, I'm going to have Wesley come up here and talk a little bit about this section.
Thank you, Kathleen. So the health department's been working for about a month to look into the future at our COVID response and recovery from 2022 to 2024, and looking at the American Rescue Plan and the eligible uses under it and kind of compare them. And, one reason we wanted to put all this up here is the mitigating COVID use. That's the first eligible use under that plan. There's a lot of different eligible uses under that. And so I just wanted to give you a flavor of the type of requests that we're looking at and the needs in that time frame. So Kathleen laid out the 3 big buckets under this first section. COVID-19 response, those are the elements that we've been coming to present to you about for the last year and change. Kind of the core elements of fighting the virus and recovering from it. So vaccines, testing, contact tracing. We need to continue to communicate to the public, and you can see also those items, which I don't think will be a big surprise to you. I'll point out that in the slide before, they mentioned mitigating disparities. A big component of the American Rescue Plan that they put in the plan is they don't want COVID to increase the health disparities that are already existing in communities. So a lot of the emphasis is on, hey, there are already disparities based on income, based on race and ethnicity. So where at all possible, try to use the funds to stabilize those, to make sure that the pandemic, which we know hit different communities differently, doesn't widen those disparities. And so you can see a couple of those items here: supports for vulnerable populations, use of health workers, and then we have a couple items in there about mobile clinics and telehealth programs. And then these are items that are specifically mentioned in the Act. A lot of you are also aware of the increase in urban violence that has happened across the country during the pandemic. And so they put in an emphasis in the plan on evidence-based violence prevention programs, as well as overdose and substance use prevention, and I'll also mention a lot of I was pleased, a lot of the plan that they have the use of the funds that they suggest in the plan to help to mitigate those disparities lays over really well on our CHIP, which I thought was a validation that we were looking in the right direction. And we do look at the CHIP as a way to push those strategies through and intend to include those in our request. So if you could go to the next one here. This is the next section. Most of the health department's request will be focused on the first section, but this is also in that first use area of mitigating COVID. And you see there is emphasis on making sure those health disparities don't widen, impact on households, tourism, and small business. You can go to the next slide here. And a couple of items that we've been discussing here to make sure that that does not happen. Direct food assistance to the community. We've talked about a lot of people losing their jobs, moving housing situations. There's a big need for legal assistance for low-income residents, which was emerged as a big need. And then Wyandott's workforce, several needs that we identified: job training for unemployed and underemployed residents, investments in affordable childcare, and a workforce study to assess the needs of our workforce over the next 5 or 10 years. And then a big emphasis on housing. Bilingual housing navigators, community land trust as one tool in the toolbox to maintain long-term affordability in some neighborhoods, and then supportive housing. So just a taste, we continue to do planning and figuring out exactly what this is going to look like with Kathleen and others. So I appreciate the time.
So the next slide. So in the ARPA, they also discuss what they call hardest hit communities or counties. It's part of the census blocks that, and the hardest hit census blocks are actually those that qualify for where they want you to really focus on. The census blocks that are considered qualified census tracts are those tracts that have 50% or more of households with income less than 60% of area median gross income. And area median gross income here is $86,000. So 60% of that is only $52,000. So what they're saying is that in that census tract, the people that live in that census tract, 60% of them are to be living under that income level, or a poverty rate of at least 25%, meaning that 25%, then the poverty rate line is defined as $26,000 per year for a family of 4. So of all these blue charts, 89,000 people live in these blue census tracts, and which represents 54% of our county's population. And 22% of those people have incomes below the poverty line. Median household incomes in these blue tracts range from $11,000 a year in block 418, which you can look on your chart, to $45,000 down in the KU Med area. So, and it should note that like the census tract 411, where there's 66% of the 1,500 people that live in that tract live below the poverty line and have a median household income of only $13,000. So there are real needs in our community, and this is a great opportunity that the federal government has given us to address those needs. Go ahead. I'm gonna one more slide. So
We have some questions first. Commissioner Markley.
I raised my hand on behalf of Commissioner Townsend.
Good to have friends in high places. Thank you. I think the point had been made earlier in this presentation that we had until 2024 to spend the money, to obligate the money. Is there a provision for us if we wanted to or needed to go back and offset other costs or expenditures COVID related? Can we do that with this money, or would these expenses have to be after the allocation of the money from the federal government in this plan?
Certain expenses are allowable up to the time that the emergency was declared, just certain, but not, everything. So yes.
Do we have
The
any
answer is
idea
yes.
what those are, what types that?
Yeah, but I don't remember offhand. I'm sorry.
Thank you.
Commissioner Bynum?
Two questions. When we say hardest hit,
Yeah.
what are the data points being considered? Is it case rate and unemployment? What are the data sets being used to determine a census tract is hardest hit? That's question one.
Okay.
Question two is, I heard you say that apparently the federal government guidelines are saying that a median household income for this area is 86,000.
Yeah, it's actually the area medium gross income, which is the entire area.
The whole metro.
Yes.
Okay, because that's never been true in Wyandotte County.
Yeah, the whole area. And that's what is in the definition for
Okay.
the legislature.
Okay, thank you.
So it's actually saying 60% of that median gross income.
Correct.
Which is 52,000.
And then if you can help us know what
Yeah.
they measured to determine a census tract is hardest
Yes.
hit.
So, so the U.S. Census Bureau, right? They have all these tracts, and they have a definition of what a qualified census tract is. And the definition, based on the data they provide us, they tell us which tracts are qualified. But the criteria is in that slide, which states it's 50% or more of the households with income less than $52,000, or a poverty rate, where the poverty rate of the entire tract is greater than 25. So 25% of the people that live in that tract are below the poverty line. So if you either hit one of those or the other, then you're a qualified census tract. And I did want to point out, there are 38 of these qualified census tracts, and 25% of them meet both of those guidelines.
So it's all based on household income. It's got nothing to do with being hit hard by COVID.
No, it doesn't. No, because the Census Bureau doesn't have, their data really lags a lot. So it's strictly what occurred based on the data from the American Survey last year,
Okay.
which doesn't include COVID. So.
Commissioner Burrows?
Thank you. And Kathleen, you and I had this discussion over the weekend in reference to, you mentioned KU being part of that census tract.
Yeah.
That's one of the wealthiest, it generates a tremendous amount of revenue for our community. So when I saw that census tract, I did ask how it was that it qualified as an underperforming census tract when we have a lot of high-paying jobs that do live in that area. And so I'm just curious how that might skew those numbers, and if it really is needed to be in that census tract, if it's one that we may want to look at, and we're not being mandated to give a certain amount of money to those census tracts.
No.
All we're doing is identifying those census tracts if we want to invest in those through some of the proposals that were presented. I believe that is the correct
Yes.
analogy.
So I did look at those census tracts in the KU Med area, and there are a few, but the one 452 in the KU area, their average income level is $45,000 a year, but 22% of the 4,000 people that live there live below the poverty line. So that's why it qualifies.
Commissioner Ramirez?
Thank you, Mr. Mayor. And thank you, Kathleen. Just a comment. Looking at the map, it shows that we as a governing body and administration should be diligent in how we spend this. These are investments that we should make sure that are fair and spread out between these census tracts, not just the east, but throughout Wyandotte County. But it shows that we have a lot of disparity. And I just want to make sure that when we go through these processes, that we're diligent and keeping in mind that we're fair in investing and how we spend this money. Thank you.
So, yeah, So we do have a lot to go through. So one of the categories is revenue loss. And I told you that the Treasury guideline gives us a formula for calculating how much that is. And so I've done that based on my estimates for 2021. And, the guidelines actually say you can claim revenue loss for 4 years, but I'm just assuming we're going to claim revenue loss for 2020 and 21 for now. And given that those 2 years, it equates to roughly $30 million that is available. And so the reason that's important is because that amount has great flexibility. Basically, you can spend those funds on government services. And so providing services to aid citizens, maintenance of our facilities and roads, cybersecurity, healthcare, public safety. So all of those, it's wide open. The next slide. So I just want to quickly go over there. Here, on the top are the 4 categories for where you can spend. And we thought we would provide you an overview of our 7 strategic goals, or your strategic goals, and see how those 4 categories align with the goals. And you can see that all of the goals are met with the mitigate COVID and with revenue loss, most of them with infrastructure. Not so much, just a few for premium pay. On the next slide, there's this slide I'm going to pass on to Melissa Stevens, who's going to talk about that.
I'll make this quick. This is Melissa Sieben, Assistant County Administrator. One of the things that we're looking at and we'll love to discuss with you over the coming months is sort of how we leverage what we're already doing with these dollars to make an impact in these affected census tracts. As an example, WIFIA is a program that we've been discussing with you. And that really is going to attack infrastructure work in areas that were historically redlined within our community, which if you start looking at these census tracts versus the redline census tracts, I'm pretty sure they align very closely. What we're hoping to do is work with you to make these investments, then kind of layer to improve quality of life in our neighborhoods, introduce infrastructure that gives people the sense that this is a place to be, and overall improves our public image and attracts new residents as well. So that's all I had on that one, and back to Kathleen.
All right, so the next bubble here, this is a series of bubbles of possible expenditures that meet all of the criteria we just laid out. And so these are proposals that we're examining right now. And at this point, I would like to pass this off to Doug to kind of ask all of you to examine and provide your feedback on what you think is a priority.
As Kathleen said, I think this really kind of brings it as we're looking forward, and when we went through and had some preliminary meetings with commissioners and on threes to talk about where we were from how the American Rescue Plan comes into play. The different ideas, different things that could come in to be eligible expenses, infrastructure being one of the top priority for us. It is not a direct thing, but there are different ways you can approach that by coming in. Buildings fall into that category. And then there's the revenue loss category of where you redirect some of that money and come to it. But there are various areas that we see. So that's what you all should be thinking about. And there's more than this. I mean, you can spin it in almost categories are wide to come to. These are just ones that we've heard mentioned as we went through things, or we could put a pin into and to say, okay, we know we have a definite need in this area, to start to throw some stuff on the board. Is that the last slide, Kathleen? Oh, yeah. And then the evaluation process and timeline moving through this as we look ahead to our budget process, which we're just looking to do the American Rescue Plan and just mirroring our budget process as we go through and identify where we see the priorities of where we want to spend that money designated as we come into it. So we're next budget workshops on the 15th, and then we move forward into August, and then for a September adoption timeframe. And Mayor, that's all we have on this part.
Commissioner Markley?
Okay.
Thanks, Mayor. I think I said in a prior meeting, and I'll say it again, I think it's really important for us to think about the long-term benefits of anything that we're doing with this money. Like, it's great to get money and you can go out and buy a new shirt or something like that, and that's lovely. But we need to be thinking about what does what we spend the money on get us in the long term. And so a couple of things that stand out to me are we've been struggling to reach a stormwater rate structure that everybody is comfortable with. So spending some money on stormwater infrastructure so that we can lower the amount that we have to charge our residents as we increase those rates would be lovely. And I think that gives us a great long-term benefit. And then I've hammered on it before. I think we have some facilities we could stand to close. I understand that in order to do that, we need to make space in our existing facilities that we want to keep to accommodate those employees we're going to bring from the facilities we'd like to close. And in order to do that, we're going to need some money to remodel the facilities we want to keep. And I think that's a great long-term benefit as well. I would say if we spend that money to retool these buildings so we can keep them, we move employees out of other facilities and close them, every dime that we save from closing those buildings, we should put into infrastructure, and that's how we should use that savings. So those are my thoughts.
Commissioner McKiernan?
Thank you. I thought actually Commissioner Bynum was ahead of me, but that's okay. I'll just say ditto everything Commissioner Markley just said. I agree 100%. And then I just have a question on the timeline slide, which is the next one after this. It says, it appears to say, develop criteria and prioritize for today. And I don't know what the process is for developing criteria and prioritizing if that's something we want to accomplish today.
I think it would, I mean, it's important to get the feedback of what you just said. You know, if that's priorities you want to have in, or there's additional things coming in. I mean, that's where we're at today of making sure we're getting to it. I don't think building that slide was necessarily meaning definitive July 1st, but this is the stage of the process we're in. If you have ideas, thoughts of how you want to put in for priorities, if you want to submit those to us as staff, bring them up today, however they come about. But this is a time when we start coming up with what our priorities are and if these fit into them or if there are other areas.
And I guess I would just say that I'm a little unclear on what our timeline is for actually establishing the prioritization and gaining all the criteria. I mean, the slide does say today, so how are we going to lay this out? Because it says on July 15th that we'll assess feasibility, viability, and timing. So it's a pretty aggressive timetable. And I just want to know, what are our markers?
Yeah. So
goal attainment along the way.
yes, so our thought is that we want to get feedback from you individually or in the public setting here about what you feel is the highest priority. And so either between now, right now, or through July 15th, you can give us that. And then as we're compiling the list of projects, we're going to come back on July 15th, provide you that list, and also share it with the group what the feedback we got from all of you were. And then, we'll develop that criteria and the prioritization at that time. So just keep in mind that because of the size of the dollars, 87 million, we, and the pockets of dollars that, meet the provisions of the 4 provisions, it's a little tricky, but it's not, it's not like yes on this and no on that. It's actually more nuanced to that. It's, how much of this as opposed to that and where. So it's going to be a process, and this is just the first phase so that you have an idea of what we're looking at. You're going to get a lot more data and more information on July 15th.
I guess I'm still not perfectly clear on what our process is moving forward. Do you want a free-form list of priorities? Do you want a rank-ordered list of priorities? Do you want it based on these bubbles that are on this slide?
Yes.
You want us to just make something up? So I think I want to find a little bit more guideline. Do you want us to suggest prioritization to you?
Mm-hmm.
So you want us to use these bubbles?
Yes.
And prioritize them? Not, okay, that's good to know.
Yep.
Commissioner Bynum?
I think my questions are similar. So I'll put in a plug for infrastructure / stormwater right off the get-go. But I also think that we've got to utilize some of these funds for some of these more human needs, if you will. So we have agencies in our community who've been working for decades and working double and triple overtime for 14 months on issues like homelessness and health disparities and mental health issues and housing. And I thought I heard in the last week or so that there is a separate allocation coming from somewhere apart from American Rescue Plan, or else going to either the state or CDBG or something for those kinds of issues. I need to understand better than I do right now where all the buckets of money are.
And that is a perfect question. So I do want to explain. So the entire ARPA is almost $2 trillion. And there's a section in it that is allocated to the state or where locals can actually apply for grants directly. That is not what we're talking about here.
Okay.
This is the 87 million we're getting directly. I did want to add to Commissioner McKiernan's question, because we are, Doug and I are also wanting to get feedback from you on, how you would like to see the process too. So we're not telling you how we want. We want to get some feedback on how you would best like to discuss the scenarios. So, and the prioritization.
Just to kind of round out what I need help with. If we knew so here's my point. This time and funding feels like a once in a lifetime opportunity to completely eradicate homelessness in Wyandotte County. And I would hate if we missed that opportunity. If there are funding opportunities that are elsewhere outside of the 87, I need to know that. It changes my prioritization, because I'm going to hold firm to my belief that infrastructure is sitting at the top of the pile, but there are smaller amounts of money that can go a super long way on fixing some of what hurts. So we know, and Melissa, that there are agencies here in the county who believe they have plans that can eliminate homelessness. That would be amazing. So is there a way for us to see a chart, something, a graph, a rubber chicken graph with all of the potential places where money is going to flow into the community? So that's one question. And the other one is, Doug, I think I'm seeing, if I'm reading this timeline right, County Administrator budget presentation, August 19. Is that the one that we would have usually seen by now?
Yes.
Okay, so that's pushed out about 2 months.
Yeah, that's the one you would have typically saw either like today.
Got it. Okay, that helps a lot. Okay, I'll stop. Thank you.
Quickly, Commissioner Bynum, we have HUD dollars that we will be targeting towards homelessness. Very specifically, that's what those federal dollars have come down for. It's $3+ million that we have in our hands to spend. Those were some CARES allotments from last year that we haven't spent, and other dollars that have come in subsequently this spring. Separate conversation there, but we will be coming back to you with information related to that. And we have been talking to those groups, as you are aware of. You've seen me on 2 different conference calls, and we've had several others. We're at no means at a point to bring forward how to do that. Those dollars have a much longer time for expenditure. Obviously, we want to get them into the community as quickly as possible to address the concerns that we are all dealing with in different ways throughout the county. So just know those are a separate pot of dollars totaling a little over $3 million, maybe slightly north of that, okay?
Commissioner Burrows.
Thank you, Mayor. Well, and I appreciate the advocacy of my fellow commissioners. The prudent thing to do is ensure that we get the best return on investment, whether it be on the human side or whether it be on the infrastructure side. But one thing we shouldn't forget is those that were put at the point of contact dealing with COVID. And that was our public safety personnel. Many of them were put into a hazardous environment while COVID was active in our community, and are still where they were mandated to work. They worked long hours. I would like to see some of this CARES dollars earmarked for a bonus for our public safety employees, police, sheriffs, jail workers, frontline healthcare workers that we can identify through payroll. And I would suggest that we don't pay them by hours worked or by pay scale. I'll borrow Commissioner Kane's comment that when we provide the bonus be on an even amount, hypothetically $1,000 per employee, as a recognition of their duty to work during the most dangerous time our community has seen in modern times. I don't think the amount is that onerous. I believe it would be a show of goodwill, and we could do 1,000 this year and 1,000 next year when the second allocation comes out, because if it was stated by Commissioner Johnson, I don't think we're out of this just yet. And goodwill goes a long way during a crisis. And I truly believe that those dollars would be well spent to send a message to those that were on the front lines that we value your work, or we respect what you've done. And more than anything, we want to partner with you to ensure that you know how we feel that you put yourself on the front line for us. So that's one. The number of bubbles that were up there were bubbles that were thought of by the staff and going through the sheet. So I would like an opportunity for us to have a chance to look at some additional bubbles that may go in there. And one thing I didn't see in there was holding those dollars for a year or so and drawing the interest off of them, and maybe meet some of the human resource issues that were brought up in reference to our community. But I am aware that the federal government and the state will be giving money to small businesses, and those that have already received money those loans were forgiven. So it's one thing, we are not in the business of funding businesses. We are a government that is for the people here in Wyandotte County, and our responsibility is to ensure that we provide our services in a responsive and a responsible manner. And I would hope that as we go through this, we all have sacred cows and we all have things that we want to see, but broadband expansion in some of our most underserved areas in our community is extremely important, especially moving with a hybrid system that we have in business and in education. I think that's extremely important. And as we move through this infrastructure, I think there's ways to capitalize on infrastructure. We can use some of those dollars up front, but we can also bond them and set that money aside, draw interest on that money, and have it earmarked for infrastructure investment as we move forward. So it's about prioritization, but I would hope that we give strong consideration to those that have put themselves out there in the last year and a half, serving this community in an unselfish manner, protecting our health, but send them the signal that we do value you. So I will be advocating extensively for an additional funding for our public safety workers.
Commissioner Ramirez.
Thank you, Mr. Mayor. My priorities line up with both Commissioner Bynum and Commissioner Burrows. Infrastructure, we know we've been painted the dire picture of our infrastructure. That's important. And the human needs, mitigating the disparities in our community. We can have improved infrastructure, improved amenities, but if we don't have happy, healthy residents, then what's the point in investing in our infrastructure and our amenities for them? And so I think that's important. And also the public safety personnel, Commissioner Burrows is completely correct. They went above and beyond their job of what they were normally supposed to do. I always say, talk about our public health department. Unfortunately, on a normal, quote, normal year, normal non-COVID, most people don't hear about the public health department or know what it does. But last year, our health department was front and center of everything. And they did, like I said, above and beyond their job. All our staff here at the Unified Government did. And so I think we need to remember personnel, our infrastructure, and most importantly, mitigating those disparities that we have so that we have happy, healthy residents to enjoy the amenities and the infrastructure that we improve. Thank you.
Commissioner Philbrook.
Just give me about 300 million and I can get some of that spent in a heartbeat. I agree with most everybody here. There isn't anything that we've mentioned that's not important. That always makes it the hard part. Where do you spend it and where don't you spend it? Who do you not spend it on, or what don't you spend it on? Number one, of course, again, just like several other people have said, it's infrastructure. Because if we don't keep the infrastructure in place and halfway decent, it's dangerous. It's dangerous for them to drive on the streets. It's dangerous for them in their houses. We got sinkholes, all kinds of things going on. It's just not a pretty picture. And so we have to catch up on that. And that's going to be a major task. The other thing is the human needs. And that's a big, broad swatch of area. For me, when I talk about human needs, I'm talking about the housing, the wraparound services that go with that. And that means all of the stuff that affects your life. That could mean mental health issues. That could mean abuse or violence, all of those things that come along with poverty and being in situations where you can't get out. And that's tough. So along with that, then, of course, are the jobs and education, so you can work your way out. So all of that's the human condition. What I want to know is kind of like several other people want to know is, we have possibilities of buckets of money coming in to different entities that can ask for it from the federal and the state folks. But how do we know? How do we know which one of those folks are getting the big buckets of money? Unless they share that information with us. And we already know of one or two that have already gotten some funding. But the whole point is that how do we know where we need to put our the UG dollars, the tax dollars that we have been given to be? It's our job is to spend the money wisely, as Harold reminds us constantly. Thank you, Harold. And it's tough. It's very tough. And yes, I'm whining a little bit because I don't know how and where to put this money at this point without having a better idea of what some sources are going to be for some of these other areas that we're prioritizing. So I'm open for a lot of suggestions on that. I'm sure that we can ask our community partners that are helping deal with some of these other things, if they've been given funds or if they're looking forward to getting funds, so we can use the money that we have to expend in a more expedient and effective way. And the other thing is maybe we can have them help us, and we can use that money to leverage and be more successful as working as a Wyandotte County team versus just us trying to fix everything. That's where I am.
Thank you. I'm going to echo a lot what Commissioner Markley and others have said, but I think we have an opportunity to really bend the curve on some of our long-standing needs for capital improvements, streets, bridges, stormwater, and the redevelopment of builder-ready blocks. Again, we will have a continuous hole in our tax base until we redevelop those parcels in our community that have been hollowed out for decades. that still require the infrastructure, still require police and fire, still require all the services we provide, but generate no income. And we have an opportunity with the right kind of strategic investments in those areas to bring those back into production, generating revenues and bringing new population, new people living here. That will be a long-term support to help us solve the other problems that we see faced here. We have to be strategic and focused and intentional that we want to change the trajectory, long-term investment in our community. So the last comment we have on that. Mr. Bach? Yep.
Thank you, Mayor. That does conclude the presentation. We appreciate all the feedback. This will be an ongoing process as we work toward building a budget for presentation in the middle of August, as we continue to target and figure this out. We are down, Mayor, to traditionally we'd stop in about 7 minutes. So I'm assuming to move to the next presentation would be a little, wouldn't quite be able to do what we'd like to do. I would like to give a little preemptive side to it, and you have the presentation that was submitted out to you. The next section is really on recruitment, hiring and retention of employees. And for me, this has become a very big issue. It's one that I think some of you have recognized tonight as you talk about different areas to maybe do some bonuses out there to some employees. The problem is much bigger than that. I mean, it is one where we are at an all-time high of number of positions that we're posting, and we're not even in an aggressive posting manner. I've still held back on a lot of positions from last year's timeframe. But we're at an all-time high right now of the number of available positions. I think if we filled every position we have on the board today, Renee, what was that number? 187? 191. And that's ones we're trying to fill, which is no doubt impacting our work. I mean, our ability to get out, remediate in the community when we're just trying to work in our park systems, trying to do maintenance on our streets, working in law enforcement areas, both police and sheriff's departments are both hindered greatly in areas from working in the jail, on the streets, to the dispatcher operations. So, and then my back of the house operations are also having a difficult time. So those positions are spanned across all the way from our maintenance workers to our professionals working in engineering or in technology in various areas like that. So we'll step through this with you, show a few things. We did our survey too last year with the employees. There's some good input that we received from those groups, so we wanted to point those things out to you. But salary is a big issue that comes into it. It's one that's identified out there. Employees identify that, and I think you see that in all organizations, but it's key in ours too. But just to show some of the discrepancies that's happened, when we look back to the compensation plan that we did back in 2015, at that time we noted we were really toward the bottom of where we were in our comparables. Well, over those last 6 years, we've done a few very low COLAs in comparison to what other competing jurisdictions or private sectors are doing. And now as we're coming out of COVID, the economy is returning to normal, this is really impacting our ability to hire, and it's impacting our ability to retain in a lot of different areas. So that's the intent of this next section. I will hold it, and we will probably lead off in our next section for that one, and unless we want to add another one for tonight, but I think we've already doing a surprise one for that anyway. So we will try to work on this more in the 15th as we move into our next sections, but it is becoming a very big issue for us. Mayor, with that, I will conclude unless there's any other comments in the last 5 minutes or questions.
Okay, well, we look forward to this presentation. Again, probably more hard news to hear, but need to hear it. That concludes our special session. We will reconvene at 7 o'clock for the full commission meeting.